Here we are again. Welcome back. So, did you look up your 3 disharmonies of blood? I hope not. I hope you tried to do it on your own first. Do try that with these questions. And then, of course, they're to spark discussion. They're just to spark studying or research. So, I do want you to go and look back. And I know this week is going to seem easy because it's all foundations you learned on day 1 of your college education, but still very important. Okay, so the 3 dysfunctions of blood. Before I get to that, let's talk about the 4 functions of blood. So yesterday we talked about qi, which is yang, and we saw it had all these great yang aspects to it. But blood, of course, is yin, so its functions will be very yin. So blood is, these are functions now, moistening, nourishing. It rules the hair, the quality of the hair. And also it anchors the shen, anchors the mind. The most silly thing I teach in my boot camps when we talk about trying to memorize the functions of blood is if you remember those Pantene commercials and the Pantene woman, I think they're still on, she's got her hair flowing around. Well, that's how I remember the functions of blood. So we have this beautiful, abnormally shiny hair flowing in the wind, and it is moist, it is nourished, and it's also hair. So there's 3 of your functions right there. And then I imagine that Pantene woman grabbing her head and pulling it down. And so that she's hanging on to her shen. The blood helps to keep the mind and the shen in residence, right? So she's hanging on to it, she's flipping her hair around. Totally silly, I get it, but you will remember it on the exam, and I can just see you in the exam now doing this if they ask about the functions of blood. So that being said, when we look at the dysfunctions, then you want to remember, just like qi, well, what are the functions? And let's just make them abnormal. So the dysfunctions of blood are blood deficiency, blood stasis, and the one that most people forget for whatever reason, blood heat. So let's take an example like we did with qi yesterday. And by using our functions, we'll understand what the dysfunction looks like. So if someone has blood deficiency, can you think of what they might be manifesting in a case or in clinic? So let's go through our functions. Remember our Pantene girl holding her head down. So first of all, they might have dryness because blood moistens, and that is a huge symptom of blood deficiency. They might also, remember, it nourishes. They might have some weakness. They might have some fatigue, and because that's not nourishing in the body. Remember, it rules the hair, so they might have split ends or very wiry hair, unhealthy hair. It might just look not shiny. And also, because it rules the mind, it grounds the mind, there might be things like depression, or there might even be some types of insomnia, light sleeping, because the shen is not being rooted properly at night. Okay, and we could do that for blood heat as well. We could do that for blood stasis. Blood heat, again, the 4 functions of blood. Let's just add some heat on top of it. We have a patient. They come in and they have a very restless mind, very agitated. They have red rash on their body. Their skin is very, very dry. And perhaps even their hair looks very fried from the heat. And they might have constipation and dark yellow urine and all these kind of heat signs running through them. But when you sit back and look at your case, your patient, and you say, okay, their hair is affected here, they're dry, they've got red rashes everywhere, their mind is affected, I do know that the blood rules all these things. It looks like that's, if I poured some fire into the blood, this is probably what's going to happen. So there you go. There's your 3 dysfunctions of the blood, a practical usage in clinic, and then also remembering your functions of blood and see how those combine. And again, go to a case in your clinic, your student clinic, something you find online, any kind of case that has blood in it, and I want you to look for the functions to understand the dysfunctions. And this is a very good way to remember it. I'm not a big fan of memorizing in TCM, except for some things like point location. Really, you need to understand it common sense-wise, then you can break down any case and be it clinic or on an exam. All right, I will see you tomorrow when we talk about the 3 treasures. So go ahead, do a little study, and I'll see you then.